Greetings, Power Up nursing champions, nurses, nurse advocates, healthcare administrators. We are very excited today. I'm sitting in the shadow of Vanderbilt University, quite an impressive organization for academic excellence. And I'm here with Power Up Nursing's VP of Education, Dr. Kimberly Delbo, and we are presenting at a Nurse Leader Summit on ultra nursing and helping nurses, no matter what stage in their career, find stronger voice, find allyship, another word for mentorship, where you kind of ally with somebody that can boost you and move you forward, as well as finding strategies for decreasing burnout, medical error, improving retention at hospitals. And there's a whole division of what we're doing that we really haven't talked about publicly. And I'd like to talk about that today. As everyone knows, our mission is to advance the science and the spirit of nursing. And we're doing that in different ways, whether it's having events. Go to powerupnursing.com. You can see our blogs, our references, our recommendations. And at the same time, we're also working inside of hospitals to help transform the landscape, not just integrating nursing, but helping nursing become the leading role in the reformation of healthcare. And as we all know, it is really time for lasting revision, re envisioning, and reform. Today, we're going to talk about where it all starts: the students, those that come to us excited and impassioned about becoming a nurse, whether it's an RN or an LPN. They want to serve the healthcare industry. And I'm going to bring Dr. Delbo on now, our, like I said, vice president of Power Up Nursing, but she's also a chair at a nursing school, as well as a consultant to nursing programs around the country, on how to make this passion for nursing stick. Welcome, Dr. Delbo. Kimberly, it's so great to be doing this podcast today.
Oh, and it's such a delight to be here with you today, Tanya. Thank you for inviting me.
Nashville. Look, I have a guitar on the wall behind me. Yay! Celebrating
So
the music.
exciting.
Yeah, wish I could sing, but I talk a lot, so that's secondary. Kimberly, why are we developing? We have an ultra nurse program for U.S. hospitals, and people have begun to talk about that. But we are also now simultaneously looking at an ultra nurse ultra student program. Can you talk about the problem, the percentages, the background, why it is so critical? Not only is there a nursing shortage, but there is nurse dropout at the bedside as young nurses, but even before that in nursing schools.
Of course, Tanya. So today's students really experience an unprecedented time in our nation, in our world, globally. There is a high level of stress and burnout and mental health crisis across organizations, across communities, and ultimately our world. So this what we're developing through Power Up Nursing, our Ultra Student Nurse program and our Ultra Student program, is really to combat and address the fact that nurses are experiencing high levels of stress, that it is impacting their success, academic performance, as well as their success in life, realizing optimal performance in every facet
The
of their.
statistics are alarming, right? It's
Ah, the statistics show that actually among nursing students, 54%, according to Healthy Minds survey data, 54% of nursing students are experiencing a mental health issue, stress, at anxiety, depression, at the highest of those levels. And it's higher than any other student population is among nurses. So this is critical. When we look at the data, it's showing us that it's absolutely imperative that we find solutions, because 18% of new nurses within the first year of becoming a nurse are saying, I don't want to be a nurse. And
wow.
this is,
After
yeah,
spending all
it's
that time, money, excitement, 1 in 5?
nearly 1 in 5 are saying, I don't want to be a nurse. What did I do? And that just, it grieves my heart, right? And we have to find a solution that's going to work. And that's what led us to finding the Ultra Student Nurse program for student nurses. But then we got thinking, wow, it's not just student nurses that are also, struggling. Although 50% of them are saying after they start a new job that they want to leave that job and find a different job. So
Well,
we're,
wait,
we're
wait.
really,
I'm going to stop you. 50% of nurses leave their first hospital within the first 2 years. That's nurse.org. Again,
yes.
that's important. Half of all nurses get a job at a hospital and leave within 24 months.
Absolutely. And on top of that, we're seeing how this impacts quality care, our patients, right? And that's the beloved beneficiaries of those who we are called to serve and make a difference. It's our why of why we enter the profession of nursing, why we decide to become healers and ultimately impact the lives and make a difference in those lives that we serve. So, when we look at those statistics, medical error is at an all-time high in addition to the turnover and burnout rates. So when it really is imperative that we find these solutions that are designed to meet the needs proactively. Upstream, while the students are matriculating through school, that we provide them the resources that they need to live healthy lives, so that we better prepare them to enter practice, to avoid that from happening altogether. So that's why I love what we're doing and feel so very passionate about it.
Now, we're talking about preparing, let's focus on our nurses, but preparing nursing students not just for academic success in nursing
Mhm.
school, but to be able to go out into those first bedside jobs with some resilience with so
Mhm.
let's talk about what the curriculum does, what it is involving, how long is it, how does it work? I know there's already several nursing schools excited and ready to begin putting this into budget and putting this into reality for their students as soon as possible. What is the course?
Yeah, so the course is basically it comes alongside the professors and could be seen as a standalone program within their programs over a 15-week period, a semester, or they can tailor it down if they have 7 week semesters. We can easily do that, not a problem. It can be seen as a train the trainer type of program, or it can be also implemented as a standalone program that we could provide for the students. Either way, but it really is designed to, like you said, address their and promote optimal health and performance holistically, while meeting their needs to increase resiliency and well-being on
How?
all levels.
No. Well, we do know that the Ultra Human Ring, which is a core partner to Power Up Nursing, that is, I always say in all my presentations and all my meetings, you can't improve, you can't change what you can't measure. And in
Absolutely.
our data-driven, AI-driven world, we are so equipped to be successful. So
Mhm.
talk to me a little bit about how and what's the content. I mean, you don't have to get into
Yes.
all the details, but what is the content and then how do the students and ultimately the nurses measure that?
Yes. So obviously, it starts with looking at their overall health and analyzing that baseline data using biometric feedback and the ultra human air ring that is coupled with our interactive workbook that they can purchase for all of their students. So that allows the student to engage in self reflection and using internal practices, using and also external technology to measure those key components of their stress. It looks at resiliency, well-being, sleep. Measuring that sleep index is so critical. We know that our students don't sleep nearly enough, and this impacts them greatly, and even humanity in general. We don't get the sleep that we need. Nutrition, education, and helping us to make better decisions, right? While looking at cognitive behavioral interactive exercises that are integrated within the sessions and the learning over the course of the
And
semester.
some of the measurements, because my life has changed kind of dramatically wearing the Ultra Human, right?
Oh,
It
yes.
helps me reduce cortisol, which
Yes.
helps reduce hunger, which helps me reduce stress, which gets me better sleep, which gets me just a whole new level of creativity in my life. But we know that it's sleep. We know that it's heart resilience. I know you've been working a lot with Bruce Cryer in the whole world of HRV, heart centered resilience. What is
Mhm.
HRV and how would that affect our students?
Yeah, so really looking and having the students monitor their heart rate variability. And Bruce is an amazing man. Having I think 20 some years at being the co-founder of Heart Math Institute, he's empowered me with the understanding of heart rate variability and how that can be measured. And again, using our ring and the biofeedback that's provided, allowing us to look at how our heart rate fluctuates over time, and what that means, by having a lower heart rate variability, how it impacts how we show up, and how we address stress and ultimately show up with resilience in our lives. So that's really the empowerment, through our breath work, in living a heart coherent life. Ultimately, engaging in reflective meditation, and simply using the very thing that gave us life, our breath,
Mhm.
to control our heart, and showing up in a way that our heart shines through everything that we do,
And
from
you are the epitome of heart
uh,
shining through. You are the nurse's nurse. I have to say that with all the authentic, heartfelt truth. You are the nurse's nurse. I've seen you go through kind of the ups and downs of life, through COVID, through becoming, an academic lead that was new to you versus bedside. You are amazing because at the core of all you do is the patient. And if we can take that, and then we work with others in Power Up Nursing, Audrey Boyce, Dr. Alba Rodriguez, of course, Dr. Carol Biggs, right, senior executive at Jackson, in order to create content in that workbook that is not only vetted but also absolutely effective. And now we actually can measure that effectiveness, which is really the driver behind Power Up Nursing's partnership with Ultrahuman Smart Air. Very, very exciting. I'm going to just take a minute because I'm looking at some of the work that you're doing with the nursing schools. This is called UltraNurse UltraStudent, Elevating Health Performance and Academic Success. But I'm going to read a little of your description. We're transforming stress into strength. And I think there's not a single student that wouldn't just thrive by listening to that motivation. Elevate well being, achieve more. The UltraNurse and UltraStudent programs are groundbreaking 15-week evidence-based courses designed to empower students, especially nursing and healthcare learners, to optimize their health, academic performance, and overall well-being. That, and then you go on to say how the ring is the anchor, how there is a workbook, and then there is training. And then I would imagine there's content online, etc. This is very exciting. How would a nursing school go about thinking about this program? It's a per student kind of charge, that there's a program that you're going to train the trainer, and then there's a workbook that comes with a purchase code for the ring for the students. Is that basically?
Exactly right. So basically it's per student, just like they would purchase a textbook,
Mhm.
for their course, they would purchase something that they can have for throughout their whole time of matriculating through their school. They would
Moving
have the
on
rate to
at the
help guide them, but
bedside.
we would empower them their very first course into
Mhm.
into higher education, to help empower them to live this beautiful life of optimal success and well-being. And just as the title there says, ultimately, helping them live healthy lives, so that they can optimize their learning in the process and realize success in every facet of their life, personally, professionally, for years to come. So it
Mhm.
really truly is an upstream intervention, that we're promoting here, using technology as an acceleration driver, to guide and provide that very important data and feedback for the students right where they
Yeah,
live,
yeah.
work, and play.
And
and
I've
they're
heard this, and I put this up on the screen. We're training the nurses to monitor their emotional and physical vitals for themselves and their patients, right? Because in nursing school, so much about it is about vitals and what they mean, right?
Mhm.
And unfortunately, I've been a patient at a hospital, or fortunately, and vitals are it. We always complain, oh my gosh, they're back to take vitals. Well, we know that, once again, you can't improve what you can't measure, and you need to have that core measurement. So getting nurses to actually become aware, self-awareness, right, is everything, of their own vitals and when they change and how they can improve them is an awesome idea, Kim.
Oh, yeah. And it really centers around self-awareness, right? And which is the cornerstone for nursing and leadership. And truly, when they're able to know where they stand, they can personally better understand themselves. They're able to then provide better care to the
Mhm.
patients. Our energy is felt 3 feet outside of our body. And think about where nurses spend the majority of their time as frontline providers, right? It's
Mhm.
at the bedside with the patients. So think about the impact that this will have also on the patients in which we have the privilege of caring for and serving. So it truly is a passion, but also we just know that it's so needed in our society because so many people are hurting and they're suffering, on so many levels. But especially this population of nursing students and students in general, and matriculating through schools.
Yeah, for sure. And I think the prime opportunity, I know that I've worked with Ultrahuman now for a year, and I know they're looking for pockets of research to really make a difference. And obviously, to get a group of nursing students and compare them to a non-ultra sized, I like that, ultra sized group of nurses, and to follow them, to follow
Yes.
them. And if we can even get their engagement to follow through those first 2 years of nursing, where
Mhm.
most nurses just give up and go on to become, I don't know, I know a young woman who has an RN degree and now is doing customer service for a telephone company because she just couldn't take all the overwhelming nature of being a new nurse. That would be profound to have evidence that just learning how to monitor your sleep, your stress levels, your heart rate drops, and being able to intervene with easy behavioral modifications, um, that's a life changer, not just for nurses, but for all of us.
It is absolutely for all of us. Exactly. It's not just for nurses. It's not just for students. It is for everyone. And the vision is that once we have nurses doing this for themselves, then they're
Mhm,
empowered to go out there in their organizations and embed this beautiful culture of change and health with across healthcare that can then be scaled out into the community to
mhm,
impact every person, because at
mhm,
the center of who we are lies our heart and our humanity and our health. And without those things, where are we in life, right? So and as a society, we must look after one another. So who better to do this than to empower nurses to
mhm.
lead the change in healthcare
I get lost
and
when you talk,
reinvention.
Kimberly. I get lost when you talk because you're just awesome. It comes from you don't even
So
know
kind.
what you're saying, and it comes out so amazing. Um, Kim has a Kim at Power Up Nursing email, but there's a little problem with that today. So I wanted to put up her personal email. If you are a nursing student, if you are an administrator at a nursing school or a fellow chair, as Dr. Delbo is, reach out to Delbo Kimberly at gmail.com for information. Um, I think, you know, I think, and as the CEO of Power Up, I can say if you're a nursing school that's interested in this program, it will be ready by fall semester 2025. But we're only going to take on 3 nursing schools because we want it to be outrageously successful, and we want there to be some um, um, just clinical research as the infrastructure. So please, if you're interested, reach out as soon as possible so that Kimberly can explain the parameters of it. And if you are uh, qualified and by yourself and by Kimberly, we would love to get you into that first group that would go ahead and launch this in academic 2025, 2026. This is my email. Let me put that up. And if you have any questions about what Power Up Nursing is doing at hospitals, at events, online, please reach out to me. You can find both of us on LinkedIn. We spend a lot of time there talking to people. And we are about ready to leave and become a part of the Nurse Leader Summit here in Nashville. And we are just so grateful to everyone that listens, to everyone that participates, to everyone who supports our partners like Ultra Human, Moxie 360, and you'll learn more about that if you're a hospital. But we appreciate you. And Kimberly, because you are really far more eloquent from the heart than I am often, I'd love for you to close us out and really encourage people to, get involved with Power Up Nursing. Go on to powerupnursing.com and tell them why. And then we'll see you all soon. So, Kimberly, the stage is all yours.
My pleasure. Well, I want to just thank everyone again, reiterate, we appreciate all of our partners that are coming together to help us to elevate our mission, which is to advance the science and spirit of nursing while empowering nurses and students and healthcare and academic institutions, everyone, to truly embrace and elevate the health and well being of everyone in humanity. So, thank you for your time today and for listening. And we look forward to seeing those that will be at the Nurse Leader Summit in a few hours. Have a wonderful day and thank you. Reach out to us at our emails that were provided. Thank you.